My name is Marilyn Nunez Herrera. I'm a rising senior studying chemistry at Delaware State University. I worked with Christiana Care and the Value Institute to study perspectives on diabetes prevention, care, and self-management in Hispanic communities. In Delaware, there are a few culturally appropriate Spanish language prevention and self-management interventions and healthcare options. The purpose of the study was to understand barriers and facilitators of diabetes associated with prevention, care, and self-management. We also wanted to gain perspectives on types of interventions that would help address these disparities among Hispanic communities in Delaware. Our study was conducted with 2 focus groups. We had 10 participants total, and our participants were known as promotores. Promotores are people who were trained to provide diabetes education in their communities. We used standard qualitative methods to analyze the focus group's data. I'm going to provide highlights of what we learned. Barriers perceived by focus groups are as follows. Participants noted that their communities had poor eating habits such as big portions and higher intake of carbohydrates. They also noted people lacked information of what was considered healthy and unhealthy. As for physical activity, they noted little to no leisure physical activity due to lack of time or being tired from long hours and/or labor-intensive jobs. When it comes to access to care, participants noted poor experiences due to discrimination, lack of trust in physicians and the healthcare system, fear due to immigration status, cost, and language barriers. Some community members even avoided seeking care due to these barriers. As for diabetes care and medication adherence, they mentioned much of the same barriers for access to care, in addition to lack of information. Because of these barriers, people would often turn to natural remedies or have misconceptions of their care and/or medications. Facilitators for healthy eating included getting more information on healthy choices, and people who had family support also noticed an increase in physical activity. Participants noted that having a physician that was patient and treated the patient as a person had better outcomes. And to improve diabetes care and medication adherence, they suggested more information on the disease, its medications, and person-centered care with a physician who also understands the emotional aspects of diabetes. Our study was limited to 2 focus groups, and further research with stakeholders, community members, and patients will be needed to create a culturally appropriate intervention that will address these disparities. I would like to thank Christiana Care and the Embry program for this experience.